The Centers for Disease Control and Prevention released updated guidance Friday as coronavirus infections overwhelm healthcare systems nationwide. For the first time, the CDC is urging universal mask use. The agency now recommends face coverings be worn indoors and outdoors whenever away from home. This week, COVID-19 became the leading cause of death in the U.S., surpassing heart disease and cancer. More than 278,000 Americans have died from the virus since the pandemic began. Nearly 2,900 died on Thursday alone. More than 14.2 million cases have been confirmed nationwide. Meanwhile, the Food and Drug Administration is expected to meet next week about vaccine approval. It will consider Pfizer's application for emergency use of its vaccine, then discuss Moderna's request the week after. Adriana Diaz begins our coverage.
Tonight, the CDC says if you've been exposed to COVID-19, such as during travel or in a crowded setting, you should wear a mask inside your home to protect your family. This as cases and deaths continue to surge. Here in Illinois, the 7-day average death toll is higher than any other state, up nearly 14% over 2 weeks ago. And at least 11 states shattered their daily case records, with more than 217,000 new COVID cases nationwide added Thursday. That amount could fill the University of Michigan's football stadium, the nation's largest, twice.
Soon, if it keeps going, we're not going to have anywhere to put these people. We're just not.
Meanwhile, as states scramble to meet today's deadline for Pfizer vaccine distribution plans, the shipments may not be enough to cover the first in line. Wisconsin's governor is worried about vaccine delays after backlogged test and PPE deliveries. Writing to Health Secretary Alex Azar, as vaccine distribution gets underway, our state cannot afford to have this pattern of failed promises repeat. And still, Americans seem to be taking more risks. Last night, at least 150 people, including Florida Congressman Matt Gaetz, reportedly gathered for the New York Young Republicans annual gala. That prompted officials to shut the New Jersey venue down.
It is beyond the pale that anyone would willingly endanger people in another state, never mind their own.
Letitia Lara knows that danger firsthand. She survived COVID, but her 18-year-old daughter, who had special needs, did not.
How are you feeling?
Like my world is ending. I feel broken, lost.
Her husband also has COVID, and he's sedated and in the ICU, so he has no idea that his daughter died. We also have news on the vaccine front, Elaine. According to Moderna, there's a new report that says its trial participants still had those protective COVID antibodies in their blood 3 months after their second doses. Elaine.
Adriana Diaz, thank you. Healthcare workers in several states are sounding the alarm as hospitals nationwide are pushed to their limits. As Nikki Batiste reports, they're demanding officials do more to slow the spread.
As COVID-19 cases continue to soar, healthcare workers are raising their voices. Dozens of Connecticut doctors, worried about increased hospitalizations and deaths, sent a letter to Governor Ned Lamont with an urgent appeal. Shut down indoor dining and gyms now to stop the spread.
So you have to be constantly vigilant.
The letter, spearheaded by Dr. Luke Davis, prompted an online petition signed by more than 750 people. Despite new vaccines on the horizon, he reminds the public not to let down its guard.
What is going on inside your hospital that you think people aren't realizing out here?
Well, I think that we're all getting tired. It's a very difficult disease, and the thing that makes the biggest difference is just not having the hospitals be overloaded, having enough staff to take care of people.
Dr. Davis is a critical care physician at Yale New Haven Hospital, where admissions for COVID-19 have nearly doubled over the last 3 weeks. The ICU is nearly full. And in Wisconsin, thousands of healthcare professionals wrote an open letter to the public, imploring all to take the pandemic seriously and to take action to stop the virus. In New York, roughly 200 nurses went on a 2-day strike at Montefiore New Rochelle Hospital.
We don't have enough staffing, so we can't take adequate care of the patients.
According to the CDC, at least 866 healthcare workers have died from COVID-19. One was Houston Dr. Carlos Araujo Preza on Monday, his daughter Andrea Araujo.
Just be a little bit safer so that no one else can go through a tragedy like this.
Dr. Davis told us Governor Lamont did speak directly with him and several colleagues who signed his letter. The governor told them he will monitor the situation, but so far he's made no changes here in Connecticut. Elaine.
Nikki Batiste, thank you. Dr. Caneri Webb joins me now. He's the Director of Healthy Policy and Equity at the University of Virginia School of Medicine. He previously ran as a Democratic candidate in Virginia's 5th Congressional District. Doctor, thank you very much for being with us. The CDC is recommending now universal mask use. The new guidance is urging Americans to wear masks indoors when they're not in their own homes. Now, this is the first time that we're seeing this particular kind of push for face coverings by the agency. What does it tell us, Doctor, about the severity of the pandemic right now and the role that masks play in fighting it?
Well, it's well established. The role of masks is really important for preventing that spread. But, where we are right now is we're in a really critical third spike. We had a big spike back in April. We had another one in July. And now we're at one that seems to kind of dwarf the other two. And I think that everybody, no matter your politics at this point, is recognizing we need to pull out all the stops, everything in our armamentarium to stop the spread of COVID, to protect our capacity in healthcare space.
Well, California's Governor Gavin Newsom is going to be issuing a stay-at-home order, the strongest measure the state has seen since the spring. Is this something we might see more states doing, or are there other ways that states can tackle the surging cases?
Well, I think states have to look at all the options. And of course, in California, part of what the governor is trying to protect against is the lack of capacity in hospitals and healthcare settings. And anytime, that's our last line of defense for individuals. We have a lot of folks who may contract COVID. Only a percentage of them are going to be hospitalized. But we saw this early in the pandemic. Our ability to treat and successfully guide people through a course of illness with COVID is predicated on the resources we have in the healthcare space. And if that gets overwhelmed, then we're in a really tough spot. And so I think that Governor Newsom's really trying to protect that capacity in healthcare settings. It's hard to extrapolate what happens in California or Texas or Florida and compare it to every other state, because those are the states that really have seen really incredible volumes of cases. And I think that even that's regionally based. And so I think that, yes, you're going to see governors all over the country have these conversations about some level of pulling back, moving back to some level of shutdown. And I think that people need to know that their best defense against that course of action is taking all those public health measures, wearing those masks, washing those hands, maintaining that social or physical distance. That's really our best course.
Meantime, health officials expect the U.S. to have enough vaccine doses for the entire population by June. Right now, the plan is to leave distribution of those vaccines to the states. What kind of obstacles will state health officials face?
Well, you're going to see that there's no one-size-fits-all in all the states. And so every state's going to have to approach it a little bit differently. But I have to flag just the incredible disparities that we've seen since the beginning of COVID-19, and specifically with regard to race and ethnicity. And so certainly the Black and Latino community have been the hardest hit in different ways. And even still, we don't have adequate data regarding race or ethnicity in terms of hospitalizations, and even sometimes in terms of deaths. And so there's going to be a call for folks to make sure those vaccines are going to be dispersed equitably. That's going to be a big part of the conversation. And that's even before you get to conversations about, the storage of Pfizer's vaccine and the temperatures that you need. That's going to have some challenges disseminating that in rural communities. And so I think we're going to really have to look at those options. Every state's going to have to approach it differently. And then, that rollout is going to be tough, because some of the individuals most likely to spread the virus are the individuals who are last on the list in terms of the phase of who's going to get COVID. And that's because we want to protect the folks at greatest risk of contracting COVID first. And so it's going to be a difficult next several months in terms of who has access. We just need to make sure that as we're doing this, equity is at the forefront because, we've seen these disparities in our healthcare system and we've seen how they've really been highlighted by this pandemic. We need to make sure that the vaccine distribution process keeps that in mind.
Such an important point. Dr. Caneri Webb. Doctor, thanks very much.
My pleasure. Thanks for having me.